Hello, everyone. Today on the show, we're joined by Ganesh Padmanabhan, founder and CEO of Autonomize AI, a leader on a mission to transform how artificial intelligence is used in healthcare. Ganesh has built AI systems that tackle the most complex administrative challenges in healthcare by organizing, contextualizing, summarizing unstructured data so clinicians and care teams can focus on what matters most, patient outcomes. He's a seasoned entrepreneur, AI strategist, and advocate for ethical, human-centric AI in regulated industries. How are you doing today, Ganesh?
I'm fantastic, Ed. Thanks a lot for having me.
Yeah, thanks for coming on the show. Whereabouts are you calling from today?
I am in Austin, Texas. It's
Nice.
home base. This is where I've lived the longest ever in my life. So
Really? When did you move there? Like a long time ago? Or?
about 19 years ago, I
Oh,
came
wow.
here to work for Dell, a while ago. We're a very
Yeah.
different life, but, and the city has grown so much. But the best part about it, I know you're in New York, right? So it's like 87 degrees today, and it's the middle of February. So, this is the great choice to be in a place.
I'm still struggling with obviously, I'm from the UK. I didn't only moved to New York recently. The conversion from centigrade to Fahrenheit, I'm just, is that hot? I'm assuming it's hot.
That's right, and it'll take you a while, but then you'll know that the 20s are great, 30s are hot, So
Okay,
we're like
okay.
having late 20s here, so it's amazing.
Nice, nice. Um, yeah, obviously we're here to talk about your business, and I thought we could start with, in one sentence, if you can, or a short summary.
Yeah.
What is Autonomize AI?
Yeah, so Autonomize AI is on a mission to transform how knowledge work or healthcare operations is done, right? And in a nutshell, what we do is today we provide this. I mean, think of a healthcare enterprise that's run very inefficiently across the world. I mean, it's just the reality of like we're trying to optimize for so many things. What we are providing is an operating layer to layer in and become an agentic health enterprise. So where you have a future where humans and AI agents can coexist and then provide outcome at much lower cost of delivering care, increasing access to care that places you cannot get to today with just humans, and just change the operating model of one of the most critical industries for humankind, healthcare.
And I mean, there's so many inefficiencies, it seems, all over the place. Now AI's come to the forefront. It just seems like everywhere things are not as good as they could be. So it's an exciting time to be able to use this technology. Could you just paint a picture of some of the efficiencies that are around today, just to bring it to life for people, and how specifically you're going to change that?
Yeah, no, think about, today, for example, healthcare is inefficient, not just because of, the inefficiencies around it. There's incentive structures that are kind of misaligned. There's multiple parties are coming in. There is a lot of friction in the system. I'll take a few examples. Like one simple example, somebody wants to get an MRI done, right? And, in the United States, if you're covered by a medical insurer, you have to send a request. Your doctor has to send a request to the health insurance company requesting a pre-approval or a prior authorization to go do it. Now, to support that and justify why this person needs it, they have to do the work of collecting information about their medical background, describing it, explaining it, providing medical records. So the doctor spends 15, 20 minutes just putting a request together to say, I need to get this person an MRI done. On the other side, at the health insurance company, they have people you'll have data entry people who'll get this request either digitally or through faxes, still exists in healthcare. And they're typing this up. They take 10 to 12 minutes typing this up, setting up the case for a nurse or an MD to review on their end. And they will look at that request, that patient's medical history, bump it against clinical guidelines, bump it against payment policies, coverage determination policies, and so forth. And then they have to make an adjudication. That whole process, a simple request as like, hey, I need an MRI done, takes 20 minutes on the doctors to make the request, 40 minutes on the health insurer side to actually go do it, and they'll be back and forth. I'm missing this information. So you put that case to pending and then call the provider and say, hey, can you just help answer these questions? They finally get their request and stuff. It takes days, like sometimes weeks to get this approved, right? The whole MRI process is probably 15 minutes. So
Yeah.
but to do that, you're actually spending 3 or 4 weeks to go do it. So that's one example. But then that happens everywhere. You want to, somebody's getting discharged from a hospital And there is a lot of risk of readmissions that happen simply, and that happens because the coordination of care doesn't happen. The patient does not know exactly what they need to do because they're given a pile of 17 pages that actually is a bunch of data that says, here's your discharge summary. And it's got no useful information for them to make sense out of. What are the things they should do today? What are the things they need to do tomorrow and the day after? So they don't have to end up back in the hospital. So, and all of that is, we've not evolved healthcare as an industry to today's age where, things are more digital. You have, AI as an operating layer that can be used as a leverage to go change it and so forth. So all of these inefficiencies exist because there's multiple parties involved in delivering care, which is the way it should be. I mean, it's a multi-party system. And then two, each of these processes are built in an age that AI or even the internet didn't exist, right?
Mm-hmm.
So I think that's the state of operations today. If you look at an average, health enterprise, they run about 7 to 8% of operating margins, 1 to 2% of operating profits. It's a really pathetic scenario in the United States. Like you look at, the 80% of all the premium revenue for a health insurance company, 85% is spent on delivering that care. They're not going to make money. Everybody's margins are getting compressed. We have a structural issue with healthcare. And what we haven't done in the United States or around the world even, but especially in the United States, we've been solving a lot of point problems with digital tools and health IT tools and point solutions. We haven't structurally changed healthcare, which is what we intended.
Yep. And I was only reading this the other day. I'm not sure where on Twitter, something like this about MRI scanners. So it's interesting you brought it up because apparently the cost of getting an MRI to the insurance company, because often that's the case, has gone from $1,000 to $3,000 over. I can't remember the exact time period, but not a huge amount of time.
Yep.
Which is, I mean, I know obviously there's been some inflation in the system and stuff, but that seems a bit crazy. Is this the sort of thing you're going to help tackle to improve these costs?
In fact, the system is so broken that if you go to an MRI center and say, hey, I need an MRI, they'll say, do you have an insurance adjudication, prior authorization, whatever? No, I haven't. They say, hey, if you want to just pay it directly, it's going to cost you $300. And the patients are like, wait a minute. Like, I'm going to request an authorization. They're going to charge $5,000, right? And for the same service that the MRI center will do, they'll charge the insurance company a different amount than what they pay, what they ask the patient to pay if they have paying it directly. And there's a lot of these economics and the incentive networks involved. Contracting done for your provider network at the health insurance company is done at a network level, not just at a hospital by hospital level, right?
Yeah.
So there's a lot of group contracting. There's a lot of complexity in this thing. But imagine a world. I mean, just take an example of an even more, impactful scenario. Let's say someone getting a request in a health plan, get a prior authorization request for a PET scan, which is a special kind of CT scan, usually to actually detect cancers or any of the other pretty critical illnesses. That the patient has got a confirmed diagnosis for cancer. They're actually getting a request for this thing. But you also know, as a health insurance company or a care manager, you look at it and say, I can almost predict how the next 6 to 8 months of that patient's journey is going to be. The radiation therapy that they have to go through, the chemotherapy they have to go through, dietitian, counseling, consulting, all of that stuff. You can pretty much look at this whole thing and say, I can create an experience for this member by like making sure they have an oncology care navigator, making sure they get clear details on how much they'll end up paying, because it's a huge problem for cancer patients. They don't know, am I going to get bankrupt? I'm going to get cured, but I'm probably going to be broke, right? There's all of that stuff. It's impossible to do it today because we treat each of those things as episodes. The request coming in, you're projecting, you're responding to that request. It's an episode and you forget about it. 3 months later, the care manager gets a notification that there's a patient that's admitted for surgery, do care coordination. They look at it and say, oh, cancer patient. They're going through these different things. And then they look at their claims and it's like some of the claims are coming from an in-network provider, some of them from an out-of-network provider. It becomes a mess. This is the big opportunity with agentic AI. Now imagine that same experience. A request comes in, a set of agents, a coordinated set of agents goes, intercepts it, goes, logs the case, gets the doctor or the nurse involved to review it, fetches the information to go do it, but also sends an event to the care manager, and imagine that patient getting a call that same afternoon and say, hello, I'm your health insurance company calling. I know you're going through a tough time, but let me help you navigate the next 6 months. Here's a list of doctors you're going to see. Here's the procedures you have to do. Here's how much it's going to cost you, and we're there for you.
Mm-hmm.
That's the experience that is possible with an agentic operating layer in healthcare.
And how did you come up with the idea for doing this? Was it something you experienced yourself, or was it were you just researching this in the market?
Well, look, I mean, my background, like I've been a part of other startups before, was in big tech for a long time. I was always close to technology, but I also had the luxury of actually working very closely with several industries, including healthcare.
Okay.
2020, I just exited my last startup and company, and the world was hit by coronavirus, and I actually participated. I was invited to be part of Governor Abbott in Texas, Governor Abbott's task force for COVID-19. And the state of public health infrastructure was, really disturbing and disappointing, right? We were just not ready. And then you unpack that beyond just the public health, and the health infrastructure in general was disappointing. So a couple of things happened. Like I spent a couple of years studying healthcare, spent a lot of time with people. We were going through some illness and sickness in the family that gave me a firsthand exposure of how it is to manage, being a caregiver and so forth. I lost a friend to, stage 4 breast cancer. And when she was actually first diagnosed, Merck was doing their trials for Keytruda, which is it's an immunotherapy drug, first in the market, did so well. And she would have been she was eligible to be selected for their clinical trial, and she would have probably survived. We don't know that, but it's hypothesizing. But the information about her protein expression, the fact that she was eligible, was locked in some page 389 of a 5,000-page report that somebody missed, right? And that sat with me quite a bit in terms of, like, the first thing when we started Autonomize was like, look, I mean, there's a larger story here, but we tackle the clinical trials patient matching problem. That's where our first customers were life sciences customers. We work with organizations like Novo Nordisk and stuff like that. But the big idea, like when you step back, Ed, what in healthcare historically, what has happened is we have solved the symptoms of the problems than the problems themselves. So you find, patients are not getting communication. Let's create an app to communicate with the patients. Well, that app changes that communication paradigm, but that information comes back. It still needs to be reviewed by a doc, a nurse, and stuff. We didn't solve the structural foundational problems. So our big idea was like, look, and you look at all of these problems, they all use same core sets of data. They just contextualize differently by different users. So our big idea was like, if you can separate that data content layer with the context layer, the workflow layer, and dynamically pair the two, then you can solve multiple problems with the same core platform. And that was the origin for Autonomize AI. So we're like, look, we can do this. And then we started navigating and finding places where you have collection of multiple problems. That same example I gave you on prior auth, you solve prior auth, but the charts has got information about gaps in care. The patient hasn't had their flu shot. The patient hasn't had their, 13-year-old teenager is eligible for HPV vaccine. Those information are ignored because you're not looking at it as a collective system. You're looking at it as a siloed evidence, an episode. So now we are able to go expand that across and deliver value for enterprises across. And fast forward today, we power 3 of the 5 largest health enterprises in the United States. We work with several large, complex, really unique enterprises. We also work with, several other, mid-market companies and organizations too.
And why did the traditional sort of automation software in this industry, why was it not able to solve these problems? And because people have tried to do this before, but obviously it hasn't worked very well.
Yeah, look, I think there's a few different things, right? One is automation is only gonna help so much, right? If you just step back, think about it. Automation is automating what humans already do, right? So it is just like, if you're clicking on a button going from left to right, you're just trying to automate that particular process. Well, what if the whole process that you're actually following is wrong? Automation doesn't know to fix that, right? So historically, with robotic process automation, automation software, digital health, all of that stuff, it was all, to me, those are all band-aids that you put in, because you defined processes in an age where humans had to log into a screen, click from left to right, read information on the screen, and take action, right? And automation, all it did was actually, whatever you humans do, I'm going to turn it into an automated software so you don't have to do it, right? Well, that drove a lot of efficiency. No doubt it made a huge difference to the industry, but that's not enough, because we live in the United States where we have 330 million people, and there is less than 1 million MDs delivering care for 330 million people. We have less than 4 million nurse practitioners, physician assistants, and folks who are part of the healthcare system taking care of patients. There's no way you can scale. We're going to, and people are, generally, I think there's a trend towards, longer life, but the lifespan is extended, but health span is actually compressed, right? So people are not as healthy anymore. There's a lot of chronic disease problems and stuff. So where automation stops is like, you just do more of the same with automation. That's why it's what this generation, where we are now have the right tools and technology with AI and stuff, with agents, is to really autonomize those processes. And autonomizing doesn't mean, it is making that process autonomous. That again doesn't mean sometimes full automation. There may be a process that has got a regulatory oversight that is needed, a human judgment that is needed. But how do you look at these processes end to end? And how do I optimize it in a way that what part of that process should be done by an agent? What part of the process should not even exist? Can you reimagine that workflow? So like that example, I still come back to the original example. It is not a serial process of requests coming in and you reviewing it. Well, there is an event that happens. What 100 other events should you trigger based on that event? What judgments that you can make based on data? What judgments do you route to a human to make a decision? So we call that autonomizing. So how do you autonomize that particular workflow? And that's how we think we can, bend the cost curve in healthcare.
And we're talking about costs. So do you think this is, will it actually get to the end user? Like we talked about this other problem with, which we just described in about the MRI scanner with the insurance companies and how they're charged, and these layers of incentives maybe wrongly aligned along this like path. So does it actually, disrupt that as well, so we can lower health costs for people?
Yes, I think yes and no, right? I mean, there is longer term, yes. I mean, there's two things. One, there's multiple macro things that are happening. Patients are getting more access to tools to educate themselves better. So they're more informed than they were before. They also are, the hard problem is, how do you distill between noise and signal? So that's still a problem. But patients are getting more consumerized. They want the experience they see in other industries. They want to see it. And then, so there will be some disintermediation of middlemen and incentives and stuff like that. There will be some of that that'll happen. But if you look at 300 plus years of history, we've entrenched the system in the way we deliver care, how people get recruited. It takes 10 years to produce a doctor, right, in the United States, right? How do people get into the workflows? How do they work? Who do they get paid from? All of that incentive structure, employers, like, private employers are one of the largest sources of, like the government pays for half of the healthcare, Medicare, Medicaid, and then the other half is actually private employers. So it is going to be hard to pull all of that out and just say, oh, I'm just going to go directly to patient, right? So I think there's a way you think about it. What is also great about the US, there's a lot of things wrong about the US healthcare system, but one of the things that's great is it's actually the entire US system is very capitalist in nature. So if you really want to make a difference to the healthcare industry, as they say, follow the money or optimize the flow of that dollars, right? So our focus at Autonomize, we like to say, like, we want to autonomize the business of care. So it becomes, the simple mantra is like, make healthcare more profitable for healthcare enterprises, because it's not today. Make it really seamless for patients, because, end of the day, they want to make sure they deliver care, they get care where they want to get it from the person they get it, and so forth. And most importantly, the most forgotten people of the whole thing is the actual caregivers, the doctors, the providers. Make it joyful for them to deliver care. Today, it's a nightmare.
So we're scratching the surface really of how big this problem is, but we've got to start there. We talked about agents quite a few times. It's possible, this is like a buzzword at the moment, but it's buzzy because it actually has, real value. Could you explain to the audience who might not know so much about what an agent is, maybe more specifically about how you use it at Autonomize, but what is the agent, and why does it give businesses superpowers?
Yeah, no. So an agent is, it's gotten some buzz here, but it's not a new word. It's not a new thing. It's basically a self-contained autonomous piece of software that you can optimize around, hey, here's the goal for this particular, or the function that you need to perform. Here's the tools you have access to go perform this, these functions. And, here is what you're trying to optimize for, right? So you give them some guardrails, you give these agents a goal or a task, and then it goes and performs this and operates as an independent unit. What is important to understand is, like, traditional software versus AI, the big difference is determinism versus probabilistic nature, right? So traditional software, you would write the rules and say, here's what, if this happens, do this, if this happens, do this. In AI, the nature, and especially with language models, world models, diffusion models recently, all of these different architectures allow you to give an algorithm a goal and then some limitations and guardrails and figure out the best path to doing that, right? And that kind of goal-oriented optimization is how you scale, because traditional software cannot scale. You cannot, write enough lines of code to go do that, right? So agents think of them as autonomous units of, work that can be performed, and you instruct it with a goal, with some access to certain tools to perform its goals, and some guardrails on either safety or what they can and cannot do, how should the output be, how the input should be taken, how do you respond to things and stuff. You put some instructions, but you largely let those agents are basically a software instantiation of a language model or
Mhm.
kind of model, and they can just perform work and deliver that. I'll give you the same example. Like, if you're looking at if you're a doctor and you're spending time talking to patients, but you also have to write down what happened in that particular thing. There's a listening agent that'll just listen to the doctor-patient communication, package it, writes the notes in the way that the doctors will get reimbursed on, if that goes to an insurance company for any claims or approvals. B, it has all the relevant clinical information that is not missed out in that conversation. And then after that, there is a missing information. The doctor says, okay, I'm going to call your nearest pharmacy and put this prescription on. It automatically takes the cue and delivers that. So those might be one or multiple agents that can work in concert, that can be a great augmenter for that doc, having that conversation with the patient, right? As an example, like those are the kind of things that we talk
about. And, it's obvious now that agents will automate a lot of processes moving forward. And the question now is, at what point is it important to have the human in the loop, and how do you help make those decisions?
No, you look, there's the way you think about this, the intuition here is like, look, most of the agents today are built on language models. Language itself has limitations. Language is very powerful, right? Humans don't make decisions based on just what you read. It's how you feel. You draw back on your experiences. You reference very quickly the last 10 times you've had the similar conversations. If a piece of information doesn't have what you're looking for, to go look elsewhere. Agents don't have all of that, unless you define that this is what you need to do, right? So it's a very interesting problem where these are powerful pieces of software that'll be, if you can direct them well, if you can actually, put the scaffolding and go drive it, it'll be extremely powerful. Now, there are certain domains like coding, math, places where the boundary conditions of solving the problem is very finite and very, there's only so many variations into that thing, where you can go fully autonomous very, very quickly with these agents, right? And we're seeing that. Like, you can go to Cloud Code and write up instructions and it produces a website. And if it encounters an error, it'll go rework it and doing it, because everything is contained within that. Now, does that work in a production environment in Fortune 100 enterprises? Probably not, right? You have to then look at code review and make sure it's actually more enterprise production grade code. So there's a lot of that limitations. But The line you have to think about is like, if your workflow or if the task you're performing, the work you're doing involves a lot of human judgment, that could be based on the fact that like you have to draw on human experience. Like healthcare is a classic example. There is regulatory thing, I'll come to that. But then healthcare is a classic example. If you have a doctor's note and that's summarized by an agent, the agent is going to summarize it based on what's in the note. But a doctor, when you look at the note and he sees that, hey, this note does not have the BMI information that I need to go make a decision, they know it's not in there. And you can train all the models you want, but the fact, because agents are optimization engines, that's going to optimize for what's in there. But the doctor will know that I have to go outside of that, right? So it's a hard domain like that. In a place like healthcare, knowledge is not written down. These language models require the knowledge to be written down so you can train models on it, or you can fine tune the models on it, or have access to those things. Most of those things, if you're in a health insurance company and there is a request for a wheelchair approval for a prior auth or a claim, they'll call Sally, who's done that for 30 years, and say, Sally, how do you handle this? And Sally will tell you how. An agent is not going to know that unless it resides inside Sally, right? So we'll get to a place where it's going to be hard. So human in the loop and that's one part of it. Like problems that require human judgment, bring the best out of humans, use agents for the mundane stuff. The other part is regulation, right? For the same prior auth example, you should not, the government, the CMS will not allow you to approve or deny claims or prior authorizations completely with AI without an MD oversight, without a doc oversight. So there's regulatory reasons that you want to make sure that there is a human in the loop in there. The big unlock, Ed, is not to look at an absolute saying it's agent autonomous versus non-autonomous versus human in the loop versus fully autonomous. I mean, those are honestly very academic, those discussions. The real problem is like, depending on the problem, how do you layer an infrastructure where you can go from, hey, if this is a problem that I can do fully autonomously without human oversight, or with just a slight oversight or off cycle oversight, then I can just automate I can autonomize the whole thing. Or if this is something that requires the humans to be brought in at the right points and stuff like that. So you need an operating system to go make this happen, and which is our big focus, right? We believe, if you break down any of these processes, it's not one giant process. There's multiple things happening across. And how do you go determine what process to be done? And then also in the same way, not just completely believe that the way it's being done is the way it should be done. How do you optimize for that, right? So the big unlock is going to be having an infrastructure layer that'll understand the nuances of the industry and the domain, and then optimize whether I'm going to go fully autonomous or deliver autonomy for a group or a group of individuals with the right tools around them.
And you mentioned you're in some of the biggest medical practices in the US today. In practice, where do you believe you're deriving the most value today? Just to simplify it for people, is there a couple of areas that you really, transform?
Yeah. Look, I think, we took a very different approach when we started the company. And this is like, if you ask, healthcare I like to say this, like the last 10 to 15 years of healthcare in the US or around the world, digital health as an investor category did well. Health IT did well. Health services did well. But we still, if you ask a normal patient saying, has healthcare gotten better for you? The answer is no, it hasn't. It's gone worse probably, right? So we took a very different approach saying, look, we used to go and tell a health plan or a health insurance company saying, hey, we can help you, orchestrate better cost savings on care management, your cost of care, your claims, and your prior auth. And they will ask us like, are you a prior auth company? And we'll say, no, we can do prior auth than all the other prior auth companies out there. But our real value is when you compound across workflows. And so the value that we have delivered in certain areas, like of course, prior auth is a huge part. It's the largest source of friction for patients and providers and health plans across the United States, right? So that obviously is a huge part that we've enabled that for several organizations, both on the provider side to make sure they collect all the required information that the doc doesn't have to spend 30 minutes or 40 minutes collecting all that information to submit an auth, to going to the health plan and helping them navigate this, compress the time that they take to go and solve that problem. So that is one area. But the large source of value and ROI, or that we provide for our customers, fall in three buckets. Number one is shorten the cycle time, right? And the cycle time shortening will unlock, better member experience, better, lesser provider abrasion, all of that stuff, right? So how do you compress that? We just launched a case study yesterday with with a healthcare provider group called Altace. We compressed their case decision time 63%. It was the last 6 months of being live with them. And so it's incredible value. I mean, like, imagine the benefit for the patient. I pull a request in, I'm getting hearing back 60% faster. The second big part is cost savings, and this is hard and soft cost savings. And usually it's things like, if a clinician is spending 40 minutes doing paperwork, compress that to 4 minutes, do all the work for them, present it to them so they can make any adjustments and go forward.
Yeah.
We've been able to deliver things like 36,000 hours of clinical FTE hours a month kind of savings in one of the largest health plans. And then the third part is actually, this is how do you bend the cost curve for healthcare, right? And the cost curve is, it is basically better coordination of care. It is making sure that, look, if I'm catching a patient who is in the hospital before they get released, so they know what they need to do after they get discharged, where do they go? What is their next step of continuation of care? I can not just save money here, but I can lower the cost of care. That example I gave you on the oncology request, right? On a cancer request. If you know that the group of in-network providers is what this patient should use, and you help them navigate that, a cancer treatment is not $340,000 for the insurance company. It's $120,000, right? So there is those kind of, again, the business of care can be optimized around it. So those are the three vectors that we see consistently across. And workflows wise, we do utilization management, we do care management, population health, claims, revenue cycle management. So everything that touches the different business aspects of delivering care and managing care.
And something that people, they hear AI and immediately a lot of people get scared. How do you protect against the agents making the wrong decisions and things like this?
Yeah, no, it's a huge problem. So, if I'm sure you probably had a guest talk about the OpenClaw experience that happened a few weeks ago, right? So OpenClaw.
I haven't yet, no.
No, you should. So I mean, here's my perspective on it, right? So OpenClaw was from a developer perspective, the fastest growing GitHub project ever in the history of GitHub, right?
I didn't know that.
It's incredible. And what it really did, the insight there was like, the ability to actually take, create a personal agent with WhatsApp or any communication mechanism as the way to interact with the agent that has got access to all your information. That's where they went wrong. And then be able to make autonomous decisions on your behalf, right? Now, lots of things wrong with it. The architecture was not perfect. The code quality was terrible. There was like so many attack vectors opened up and stuff. But the core insight in that project, we studied it, and in fact, there's an element of the same idea. What they did was they separated the model, the intelligence layer, like whether it's an Anthropic or an OpenAI, to access to your information, your unique context, your unique memory of things. They separated the interplay of the two. You don't, but today, what do people do? They get to OpenAI, use an API, shove all the data in there, ask it to make a decision. You have no idea, but you have more control when you do this. I mean, that was the idea. Of course, they implemented it not really well. So I think what that, the scary part of this agents too, what they did was actually they didn't have the right guardrails on it. They didn't have the right layers of, segmentation of what kind of data should be shared versus not, and so forth. But the framing of the idea was actually a very unique innovation, if you think about it. So when you think about deploying AI and AI agents in enterprises, which is what we've focused on, you want to put in, you can do guardrails in multiple different ways. One, you can ensure that everything goes through a validation cycle that spans not just the engineers looking at code, which was a problem that in there, the regulatory folks. We just recruited a chief regulatory officer to actually come and help us put a playbook for that to help our customers navigate that. The clinical teams are actually involved in actually that process. It's a team sport, right? So there's a lot of that you have to do on the foundational layer. Then there is things like, look, everything an agent does, how do you build in traceability? Source it back to saying, if I'm giving you a summary, what is the source data that I use to go get that summary? defining what decisions should be made by the agent and should not be made by the agent, and baking that into the agent instructions to make sure that if you're faced with that choice, they're going to reach out to a human, get them engaged.
Yeah.
They changed the open clause. Big insight for us personally was that they changed the whole system to an event-driven system, and they separated the intelligence layer. So a lot of our customers ask us, for example, oh, can I now just use Claude to do this? Or, why do I need Autonomize, right? And the answer is actually very simple. Look, I mean, if you can just prompt engineer your way through solving all of these problems, we'll probably get there at some point. That's great, but you lose complete control, right? Because you're going to take your data, throw it to Anthropic. And by the way, Anthropic has been amazing at actually starting new businesses to take down SaaS companies that are in that particular thing. So if you're a healthcare enterprise, you give your data to Anthropic and that's doing it. Next thing you know, they're going to build an AI-powered health enterprise to go after your business, right? It's like the Amazon marketplace story that we had going on for the last 10 years or so. So I think there is a unique context, and healthcare is very unique. It's very special as an industry. There's a lot of nuance in each organization. There's a lot of nuance in the way you treat different conditions. There's a lot of nuance in how you manage different kinds of populations. There is regionality. It's not a one size fit all at all. So what you need to be able to do is know, when do I use intelligence and how do I preserve and store context that is relevant to using that intelligence? So technical capabilities exist to solve that, and we've built a platform, for example, to help our health enterprise customers are building agents on our platform, still may use one of those foundation models and premier models, but then that gives them the enterprise scaffolding, the regulatory scaffolding to make sure this is not going to go rogue, and it's going to actually be within the constraints or the expectation of a regulated industry and so forth. So it's hard stuff, but we think it's well worth it.
And obviously today you've mentioned regulation. You're building within the confines of how regulation is today. Do you think regulation is going to change in the near future? Is it fit for purpose in this new era of AI? I assume not, because it's based on how the old world worked. What do you think is going to change? Is there something in particular you think is going to change in the near future or not?
Yeah, no, I think I'm hoping it will, and I think we're seeing evidence that it's going to change. Right? It's interesting, right? Like I said, 50 to 60% of healthcare cost in the economy is borne by the U.S. government in the United States, right? Medicare, Medicaid, Medicare Advantage, and so forth. And so they have a huge incentive to actually do it. And I mean, we've been really pleased with this current administration's effort. They're thinking beyond just, I'm just going to go have a lobby or a body to go do this. Like too big in like the fraud, waste, and abuse initiative that we just heard from Administrator Oz yesterday. We were part of that meeting, and then we listened to Dr. Oz, and he was like, "Look, I mean, this fraud, waste, and abuse is a huge problem. How do we go solve it? There's a lot of these wrong coding, billing, and stuff like that." We're helping our customers solve that problem at the enterprise level to say, make sure, like, before I pay out a claim, make sure you verify the medical records meet those standards, making sure that the right code is actually maintained. All of that happens what we call prepay, before you pay the claim. So you're not just paying for it and then going and trying to collect the money back, which is a huge problem in healthcare, right? So we're seeing that. We're seeing several of this ARPA-H projects that are actually being launched to the Advanced Center, the Government Center for Healthcare, and ARPA-H projects around different things. And there's one program that recently got, I think it was called the Access Program. The economics of that program will only work if you embrace AI to build and deliver care. So to me, it's a huge opportunity. And then the administration is actually doing all they can to muscle through it and making sure that they're going to force the industry to change. And I think it'll be a huge and very relevant, very critical lever, which is also why we invested in having a chief regulatory officer in our company at this stage. So I think the regulation will change. We're seeing some, there's two parts, right? There's also, health insurance companies they're the money holders of the industry. So they are incentivized to change the behavior of the market too, because their margins have compressed, right? So what they're doing is there's a group called AHIP, for example. So the American Health Plan something. The AHIP organization there's a group of 40 plus health plans that made commitments on how they're going to improve, things like prior auth for patients, the experience for patients and providers. the administration is doing its part. I think the private industry is doing its part. And more importantly, I think the best part about healthcare today is the average patient has got a lot of tools to educate themselves, to ask intelligent questions. And, like Dr. Chat GPT is always there for them, right? It may not be all accurate, but it raises the level of awareness for everybody in the system. So
Yeah.
I think we're in this golden period. I call it the kairos of healthcare, right? This is the kairos moment in healthcare.
Yeah, I definitely agree with you. It's a golden period, it seems, across a lot of industries, apart from the ones that are probably getting disrupted quite heavily by AI. But when you're selling into companies, I'm assuming, and maybe I'm wrong, there is, a lot of people have quite a lot of reservations about AI coming into their systems and deciding things. How do you get over those barriers?
Yeah.
Is it becoming easier?
No, there's a lot of noise in the market, right? I mean, I like to say there's two kinds of folks starting healthcare AI companies. There's folks who've been in technology and they think they can actually come and, oh, I can just do this. I've done it in payments. I can do it in healthcare. And they all come in and get a rude shock of how healthcare operates. So great tech. I mean, tech is commoditized, so it's about trying to make that happen. And then there's a lot of other folks who are like coming in, new companies started from healthcare executives and healthcare folks who think they can actually just throw AI at a problem they very well know and they can solve this thing. The reality is both those camps are not, there's like one camp promises a lot of ROI and never delivers because, that's not the way it works. The other camp don't know what they're getting into, and they get hit in the face in the moment and go like, what do you mean it's going to take me 18 months to negotiate a contract with you? Well, that's the way healthcare works. So what we have done, for example, is assemble a team that is cross-functional. I have folks who were like deeply on the technology side and deeply on the healthcare side. People who have run health plans, people who have run hospital systems, people who have run divisions in FDA. So we have assembled a team that can pull the whole thing together. But I think one of the major things that we actually go in with is like it's healthcare. AI in general. There's a lot of noise. There's a lot of activity. One CIO told me like the best part about AI right now is like everybody thinks they can build, which is great for a technology organization. But there's a big difference between doing a great demo and running things in production and at scale, right? So It's very simple. We go in we don't do a lot of pilots with our customers. We tell them, look, here's our results that we've delivered for multiple organizations, including the top 3 out of the top 5 in the United States. And these are complex enterprises, multiple systems. And it's not magic, right? I try to think AI is not the model. It's like to get to value. I used to call it there's the usefulness factor in AI, right? You can build a chatbot, but if it's not going to change anything, it's not going to drive better cost savings, better experience, any of that stuff, it's completely useless. And we approach problems that way primarily. So the reality is, even if you build a chatbot, you have to make sure it integrates with the right system so people use it. You have to make sure it has access to old school legacy systems and systems of record across that entire enterprise to make it useful. So there's a big jump between I'll instruct a model to create a demo to how do you really realize value. And our single biggest vector that we've been actually very successful with is like we go with the mindset of how do I deliver you ROI, 3 to 5x ROI within the first 6 months of engaging with us. And we've been consistently able to deliver that despite the delays we see, despite the legacy vendors or EHR vendors who will put all kinds of roadblocks to actually delivering value. We still get them there because, a lot of things in AI is also problem selection. Solve the hardest problem. It's not that difficult, right? Don't go solve a chatbot easy problem. Solve the hardest problem. And then you think through it. There's a little bit of design thinking on how do you think about it. Then you have the technology infrastructure, which we built, a platform that allows you to rapidly compose a particular workflow with a library of existing agents and then pull it together to go deliver value. So there's a lot of different things. You got to understand it from a business value lens. You got to understand ROI. What are the levers you have? And then do you have the right tools to pull it all together, right? So that's how we've been actually pretty, fairly successful in our journey with our with healthcare enterprises.
Yeah, I mean that's great. How long have you been around now?
We are exactly 4 years old as a company.
Wow.
So
Yeah.
which is we're venture backed. We did a Series A last year. We've raised about 32 million to date.
Yeah.
Being extremely capital efficient in general. We tripled our annual recurring revenue 2 years in a row. I do think that there is like a 10x opportunity this year that we're seeing a lot of traction. The big thing that I would say is like, look, healthcare is very unique and very different. We don't want to be a general AI company. We are
Yeah.
healthcare native. We built for healthcare. And for that, it is like the story of Chinese bamboo, right? You got to sow in a lot. You got to actually pour the water. Like the Chinese bamboo story is like, if you have a little seed for bamboo seed, Chinese bamboo, you put it in this thing, you wait, you pour water, you wait for it, you wait for it, you wait for it. 3, 4, 5 months go by and it doesn't even pop up. Then there's a little sapling that comes up. And then 6 months later, within the next 2 or 3 weeks, it shoots 40 feet, right? And it's
I didn't realize.
incredible. Healthcare is like that. You got to put in a lot of investment. You got to make sure you're connected. We built hundreds of connectors to legacy systems. We built, foundation models that are fine-tuned and ingrained for very narrow, nuanced problems within the healthcare data set.
Yeah.
We built an ontology and a knowledge graph that actually can cover, population health, care gaps, HEDIS, all of the coding guidelines and all of that stuff. So a lot of the foundational work is done. And late last year, we opened up our platform for our customers to start building their own custom workflows and agents on it. And that's what really drove a lot of unlock for us. And, we're off to a great start this year in 2026.
And looking further ahead, then, if you were, your best possible sort of outcome over the next 3 to 5 years, where do you think we're at? Like, what's changed? How does it look like in the future?
Look, I mean, it's a very, in the age of AI, it's hard to predict anything in 3 to 6 months, right?
The next 2 weeks and about.
But I think, structurally, there are a lot of things that won't change, right? You're still going to take care of people in healthcare. You're still going to need caregivers and doctors and physicians and folks, because healthcare is not just about the data and the software and the pieces. It's about delivering care. We like to say that, like, AI should run healthcare, the business of care, the operational layer, so humans can heal, because that's what they do, right? So if I fast forward 2 to 3 years, the future we want to build, and we're helping our customers build, is a hybrid health enterprise, the agentic health enterprise, where you have humans and agents working in concert. It will not be a completely automated environment. It'll be autonomous in a lot of different ways and workflows. But the operational layer, how you move data around, how you collect information from multiple systems, how you communicate, how you collaborate, all of that will be done autonomously with agents. And where judgment, guardrails, regulation, compliance, all of that stuff will be delivered by humans. And a simple way to think about it is, we walk into a hospital, you don't have to go and spend, I don't know whether after you move to the United States, you've gone to a doctor's office, you're spending 20 minutes filling, forms as you go in. None of that stuff. You walk into the thing, you see a doctor, you get an experience, you walk out without having to think about, oh, now I have to call my pharmacy to get the medication. Do I have to go pick it up? And then, there's like physical AI, there's robotics coming in. So I think we're in this age of abundance that it's very clear to a lot of us that it's actually, it's coming, it's inevitable, but it'll require very careful consideration on how we shape it for critical regulated industries like healthcare. And I think we see a world where, like, it'll be a hybrid enterprise. If you're an employer like Dell or FedEx or one of these large, Amazon for that matter, today you depend on multiple brokers and insurance companies to help manage care for your employees. If you're a health insurance company, you want to start a health plan, you should be able to do it with one risk actuary, a few doctors, 10 nurses, and an operating layer from Autonomize AI, right? That's the future we want to build. And I think we're well on our way to do that. And we're helping our customers get to a point where, the clinic of the future should have, like a lot of very meaningful people who are having meaningful interactions, but not a bunch of assistants who are just doing paperwork, right? So all that roles will reverse, all of that, expectation, because, it's not going to be static as it is right now. People are seeking care from ChatGPT right now. How do you give that experience in an actual real environment. So there's a lot of things that's going to change. And I think we're super excited about the future we're building.
Just the healthcare operating system everyone's going to know about.
The agentic healthcare operating system. That's right. Yeah.
Thanks, Ganesh. And I thought if you're up for it, they've got a lightning round just to finish, which is just 5 quick questions, not looking for a long answer, just to wrap up the interview. So number 1, biggest myth about AI agents.
The biggest myth is like, an agent is like a flip of a switch and it just works. It requires engineering to what goes in. It actually requires you to shape it the way you want. So it's not a light switch.
That's a good one. Yeah. One workflow that will be mostly agent run sooner than people expect in healthcare.
So I would say anything that is purely administrative in nature. So revenue cycle management, claims adjudication are 2 examples like that.
One workflow that should never be fully autonomous.
Clinical decision support. I think, it's going to be like, there's the argument that you can actually have, there's no doctors in East Africa, so you should have an AI doctor delivering that thing. Well, what you should be thinking about is like, how do you make the doctor in the United States or in London have the ability to go reach that through digital means so you can deliver care? Because healthcare is not just about the data or the interaction, it's about people delivering care to people.
And finally, one red flag when evaluating AI vendors, I suppose, any AI vendors.
Yeah. There's a lot of red flags, but I would say, challenge the claims, right? Challenge what the claims they're making. Everybody can make up a lot of stuff right now, including like we actually ask our customers, like we have published case studies. We actually ask them to call our customers and talk to them and stuff. And I think there is, a lot of engineering between, hey, I want to do something to actually doing it, right? And doing it at scale and doing it well.
That's a really good point, actually. They can also make up a lot of stuff, and there's a lot of fluff that you can put behind in marketing, but
Yeah, and it's easy to sniff out too, right? It's easy to sniff out. You just have to ask a few questions, like, wait, tell me more about it. How did you do it? And then you'll find out that any agentic workflow that most people describing, either a RAG workflow, which by the way is great for a search use case, but for nothing else, or it is a chatbot use case, like as a QA on a document that is being there. It's like, oh, that's great. How do you store that data? Where do you store it? How do you know this actually agent is making the right decision? Ask a few questions. It'll completely disintegrate very, very quickly if somebody's making a claim.
Well, Ganesh, thanks very much for your time. It's been really good to go through healthcare and AI, the new OS that everyone's going to be looking out for. Really appreciate your words. Yeah.
Thank you, Ed. Thanks for having me, and I hope we can together build a great future for healthcare for all.
Yeah, looking forward to it.
All right.
Thanks again.
Cheers.
Bye.